Cervical cancer or cancer of the cervix. Human papillomavirus, commonly known as HPV, is the most prevalent sexually transmitted infection globally. Cervical cancer is a growth of cells that starts in the cervix. The cervix is actually the lower part of the uterus that connects to the vagina. HPV is a group of more than 200 related viruses, with certain types posing significant health risks, including the development of cervical cancer. According to the World Health Organization, cervical cancer is the fourth most common cancer in women across the globe. But our focus and awareness is mostly around breast cancer, which of course is common, but not so much about cervical cancer. HPV can affect the skin, the genital area and throat. In most cases, the immune system clears HPV from the body, but persistent infection can cause abnormal cells to develop in the body, which can become cancerous there. What then is HPV? HPV is actually a virus that can be transmitted through intimate skin-to-skin contact, including vaginal, anal or oral sex with someone who has this infection. HPV can often, in fact, be harmless. It is so common that nearly all sexually active individuals will contract it at some point in their lives, according to the WHO. While many types of HPV are harmless and do not cause any symptoms, others can lead to health problems such as genital warts and various forms of cancer. So how does HPV cause cervical cancer? The link between HPV and cervical cancer is particularly strong. High-risk types of HPV, especially HPV 16 and 18, are responsible for the majority of HPV-related cancers. These high-risk HPVs can cause changes in the epithelial cells of the cervix, leading to dysplasia, which is an abnormal growth of these cells. This can range from mild to high grade, with the latter having a greater potential to develop into cancer. While HPV infection leads to the development of cervical cancer, other factors such as smoking, having a weakened immune system, and long-term use of oral contraceptives can increase the risk. There is little conversation around cervical cancer, but did you know that, unlike many other cancers, this can be prevented? More than 95% of all cervical cancer cases are linked to persistent infection with certain high-risk strains of the human papillomavirus, or HPV. That's why vaccination is being done on a war footing in a country like India that accounts for nearly 1/5 of cervical cancers globally. India reports around 1.25 lakh cases and about 75,000 deaths each year. The vaccine is 97% effective in preventing cervical cancer. Well, a new study has found that the number of cases of cervical cancer have been detected in young women who have been fully vaccinated as part of the HPV immunization program. So who needs to get the vaccine? HPV vaccination is recommended for children between the ages of 11 to 12. It is also recommended for girls and women above the age of 13 to 26 years of age who have not yet been vaccinated or completed the vaccine series. Can pregnant women get the vaccine then? The vaccine is not recommended for pregnant women. Studies show that the HPV vaccine does not cause problems for babies born to women who are vaccinated while pregnant. A pregnant woman should not get any doses of the HPV vaccine until her pregnancy is completed. Why is HPV vaccination only recommended for women through age 26 then? HPV vaccination is not recommended for everyone older than 26 years of age. Some adults above the age of 27 or through 46 years who were not already vaccinated might choose to get HPV vaccine after speaking with their doctor about their risk for new HPV infections and possible benefits of vaccination for them. Can men get cervical cancer as well? Well, some forms of the virus are capable of causing cancer in both men and women. While cervical cancer in women has historically been the most common form of HPV-related cancer, CDC data shows that roughly 4 of every 10 cases of HPV-induced cancer now occur in men. The burden of high-risk HPV infection is estimated to affect 1 in every 5 men over the age of 15 years. The HPV vaccine has become an essential part of basic preventive health care for preteens, teenagers and young adults. It prevents against 9 strains of HPV, a virus that can be transmitted through sexual contact of all types, including vaginal, oral and anal sex. HPV can cause genital warts and in some people, cervical, throat, anal or other cancers.